So it's been a really tough 3 years, huh? So we've been navigating a lot. We've been navigating all what COVID brings to us. So navigating masks and vaccines and being locked down and trying to keep our loved ones safe and happy. And right when it seems like things are getting maybe a little bit more on track and getting out there, well, then there's the forest fires, right? And then we're back in our house and looking for our masks to see if we can wear them to go outside. So things are constantly changing and it's really not easy. So there's a lot going on, but we're so excited to have this conversation today with three amazing healthcare providers that support families like us and to talk about health and mental health in these times that just keep changing. Thank you so much to people who did submit questions already about the mental health and health of our loved ones. And we're going to be addressing as many of those questions as we can. And as we're going, if you think of additional questions, please just put those in the chat and we'll see if we'll have time for those as well. But keeping in mind, it's got to be general rather than specific about to your loved one. So it wouldn't be, is this medication appropriate for my son or daughter, for example? I want to introduce myself more fully. My name is Amy. I am the parent of two adult daughters. My youngest daughter, she loves music and Katy Perry, and she loves going out to Tim Hortons, and she loves using Facebook. And probably like a lot of the people in this room with their loved ones, she lost virtually everything during COVID that she used to do that was important in her life. And that was really, really tough. And we're slowly trying to help her rebuild some kind of life that feels meaningful for her and looking at her health and mental health while trying to keep healthy ourselves. Anything from learning to take the bus again or going to the library or just what's it like to be with other people. And that's challenging. And 3 years, the world has changed, and I know my daughter has changed, and probably a lot of your family members too, like changes in health that aren't so great. We're seeing more anxiety. And I wonder, is my daughter just the new person, or was she ever going to go back to the old person? I just don't know. And then, of course, we've all aged 3 years too. So while we're talking about health and mental health, I know we're always told as caregivers, oh, you need to take care of yourself, but we really, something might twig for yourself. You might think, when's the last time I got a doctor appointment or looked at my own health or maybe even phoned a friend to go for a walk. So that's something to keep in mind too. So we're really, really pleased that so many of you are here today. And right now I am going to pass you along to my lovely co-host Leanne, who will introduce herself and introduce our speakers.
Thanks, Amy. So my name is Leanne, and I am a mom caregiver to two amazing adult kids. Specifically, the one that brings me here today is my 23-year-old daughter. I often say that I came to the neurodevelopmental world a little bit later than many others who I've met because my daughter was diagnosed when she was almost 18. Prior to that, we really navigated the healthcare system, medical challenges, chronic health challenges, a lot of mental health struggles, and the autism diagnosis at almost 18 in some ways sort of made a lot of things that were challenging helped to make them make sense, and in other ways it confused us. So I still feel like we're trying 5 years later to navigate a lot of that. I think we felt like we had a bit of a handle on it, and then like some of you, the pandemic hit, and COVID kind of turned her world and ours upside down, and all of the steps that she had taken to start coming to grips with her reality and what she was struggling with in terms of autism, mental health, physical health. The pandemic basically just decimated her. And she's still living much of that now. So I am grateful that we have all of you here to share with us today, and grateful that we have some professionals who might be able to help us navigate the next part of this journey. So thank you so much. But before I do go ahead and introduce the other our panelists and our guests, we did really want to know just how everybody here was doing. And I think that there are a few adjectives that I can use to describe how I'm currently feeling. One of them is probably exhausted. So I hope if you are on a device where you have the ability to see, you should be able to see a poll. On my computer, I see it on the right of my screen, and it says VVox polling. And we have an open poll, and we're inviting you just to put a response in, just letting us know in 1 or 2 words, how is everybody feeling? It could be how you're feeling today, right at this moment, being here, and it could just be generally how you've been feeling over the course of the last little while as the world seems to be, exiting the COVID years, but are we really? So as you enter your responses, we'll be able to start seeing, how everybody's doing. And oh, there we go. Well, we're already seeing it. So definitely overwhelmed, exhausted. Oh, outraged. Thank you for whoever wrote that. Grateful. So you'll notice that some words are a little bit larger than others, and those are the words that are actually being repeated more. So the more people enter a word, the larger it actually gets in our word cloud. So interesting. Definitely seeing a lot of numb, overwhelmed, anxious, exhausted, and I'm trying to read some of the smaller words. Good days and bad days, burnt out, hopeful, happy to be here, happy to have you here. I said that. I don't actually see that in there. A little bit stressed, a little bit depressed. So yeah, it's a range, a real range. And actually, I'm feeling extremely emotional looking at these words because there's nothing like having a community. And thank you to the community of people here for sharing how you're feeling. So Teresa, we're going to have a copy of that, right? That we will be available. Do we keep a copy of that word cloud? Okay, wonderful. So thank you so much to everybody who put those feelings in that word cloud. And so I think a lot of us are at a point where we still have some confusion, some uncertainty. All of our stories are different. All of our kids are different. Our loved ones are different. And we recognize that no two people have the exact same story. But I think many of us have a lot of similar questions and concerns as we sort of enter what a lot of people are considering the next part of this journey. And so we have some people here to help us navigate that. And so I would like to invite our speakers to introduce themselves. So today we have Natasha Fernandez, we have Lori Green, and we have Yona Lunsky, all of who have asked me not to introduce them as doctors, but they are all doctors. And I guess we'll just go in the order of the names that I said. So Natasha, would you please introduce yourself?
Thanks, Leanne. So I'm a psychiatrist with a special interest in adults with developmental disabilities. So I've been working at CAMH for the past 2 years almost, and I recently started working part-time at Surrey Place as well. So 2 different organizations, but both with the same goal to support this population.
Thank you, Natasha. And Lori?
Go by she, her, and I'm a family doc at St. Mike's Family Health Team in Toronto, and have an interest in no other training beyond family doctor in adults and children with developmental disabilities.
Thank you. And Yona.
I go by she, her as well. So I'm from CAMH and I'm a psychologist by training, and I've been working in this area for a really long time. I've been living this also. I have a sister with a developmental disability, so I can really relate to a lot of the comments and things people were putting into that visual word cloud at the start. So glad to be here, Leanne.
Amy, I'll throw it over to you. Yeah.
It's over to me. Just one quick comment. I was looking at the word cloud. I think now at this point too, a lot of the things that we might have put on hold during COVID, where we were just locked down and surviving, is all those big questions like, where's my loved one going to live and who's going to take care of them when I'm gone? And that's kind of all layered on top too. That I see a lot of that with myself and with my friends. So at this point, we're going to have a general opening question that I'm going to field to each of our presenters. And we'd like to hear from each of you about what you're starting to notice or see related to health and mental health of adults with developmental or neurodevelopmental disabilities at this point. So maybe we'll start with Natasha.
Thanks, Amy. I have to say, I think things come in waves, as we're seeing, I guess, with the pandemic itself. So we have periods where things seem to be getting better, and then maybe things go backwards a little bit, and then we move forward. So it's hard to say exactly. Right now, I am in a hopeful place because I'm seeing improvements. I found the word cloud really informative for myself to get a better understanding of other people's experiences. But just anecdotally, from my experience with my patients, there's, people are returning back to their day programs, or, there's having more consistent staffing in the home. And these obviously were huge problems during the pandemic and caused a lot of behaviors and mood issues. And so currently, I think things are moving in a hopeful direction. Certainly, there's ongoing issues and we're not back to what it needs to be at, but I'd like to be hopeful right now about what's going on.
How about, thank you, Lori, your thoughts?
Yeah, no, I would agree with a lot of what Natasha said. I think I totally recognize the challenges that were happening with the changes that happened over COVID, from getting vaccination all the way through to, complete withdrawal of, and elimination of routines that everyone depended on. Certainly the caregiver burnout is large. And I think the support required for families, it goes beyond even the developmental sector, so I do see a lot in that realm, and just longer, long wait lists, that part's still there. And so I think we're just trying to come up with alternate ways to connect with services that might be helpful, even though not totally specialized. But definitely see the resilience of many people and, families that have been very impressive. I've been very impressed by, what families have created basically for themselves too sometimes. So we hope to support everybody in that kind of journey and learning what's best.
Thanks. And Yona?
Yeah, I mean, I think I can really echo both Natasha and Lori's comments from the experience of, I think, working and talking with a lot of families, that not everyone's in the same place. And I think for some families, and I saw this in the word cloud too, there's this sense of like feeling kind of invisible, or just a bit kind of under supported, under recognized, and just kind of tired. But then there's some people who are feeling like, no, like this is good, things are moving, this is good, I'm excited, I'm feeling hopeful. And the same as people with disabilities, I think, and that obviously impacts us as families. I think some people, we've been hearing this actually for a while, like, please don't mention COVID. I don't want to talk about COVID. Why do we have to talk about COVID? I've had enough of COVID. And other people really feeling kind of concerned, confused. What does it mean? What is really safe? How do I start to do things? So I think it's one of the maybe complexities we have now, is that there were certain points in the pandemic where it felt like maybe more people were in the same place. And now we have really a lot of people in different places, even within one family, right? Or even like within a week, you yourself might be in several different places depending on what's going on. So I think that's kind of tricky for people to navigate with each other. Not everyone feels understood right now.
Thanks, Yona. So true. We're all in different places and all such a variety of information. With the questions that people submitted, they tended to go into three categories. It was like physical health, mental health, and COVID. But we're going to start with COVID related questions, which still seems to be very up in the air. So maybe Lori, you would address these, and but other people, please feel free to jump in as well. First one is the old fall and winter. Do you think we're expecting another COVID wave just as always? Any insights on that?
Definitely leaning on my infectious disease colleagues at St. Mike's for some of these too, because a little bit of it's crystal balling for sure. Yeah, it wasn't such, so equivocal for Dr. Muller, who's one of the infectious disease specialists at St. Mike's. He said, yeah, absolutely, there'll be another wave. In terms of, the severity of that, it did not sound like that was going to be the same as we experienced right at the beginning. And so that part was a little reassuring. My apologies. I'm going to have to let you know I'm in the school clinic, and then you're going to keep hearing school bells because I can't mute it. And so, and I think too, the risks have changed. Like the wastewater things in Toronto, all those monitoring systems that they do, that's pretty still level right now. For a long time, the rate was declining. It's sort of leveling off a bit. And so, and as we know from experience, the fall, winter has always been worse. So there probably will be an uptick then.
Okay, thank you. So another one is, oh, sorry, Natasha, did you want to throw in something? Okay.
Me, I think someone else.
Next question is, before we learned that there were higher COVID risks for more intense COVID or even death for certain populations. So we want to know are the risks of severe illness still higher for certain populations, such as people with Down syndrome, or has that evened out now that we have vaccines?
Yeah, no, and certainly, I mean, if I look back, I share everybody's frustration at the beginning of COVID because I think that was an extremely stressful time and very difficult to get this population onto anybody's radar just about vaccination. So I think we all shared that frustration of trying to get, all the young adults and children and families who are trying to visit them in group homes in a very similar situation of long-term care and sometimes sharing, support workers and not being able to get vaccinated. And so I think that frustration still sits with us. I mean, it still sits with me for sure. I credit Yona somewhat with getting that evidence onto the science table and affecting subsequent waves and availability. I think, and certainly in terms of hearing from Dr. Muller, the sort of next waves he doesn't think are going to be as difficult for vaccination per se. And that's mostly because the public sort of lost interest in it. And so there'll be lots around and lots available. In terms of the risk for groups, I mean, the biggest evidence that we saw before was for Down syndrome and that risk. And that appears to still, I mean, it was certainly the case with that first variant. That first variant was more severe for everybody. This has been much less. I didn't see more updated research since 2021 when those initial reports came out. And Yona, feel free to chip in if you've seen anything else in this.
Yeah, I mean, I guess two things I can say. One is that what we're seeing is that, the same as, most of the people who, did really poorly later on in the pandemic were people who were not vaccinated, that we're seeing the same kinds of patterns for people with developmental disabilities. So, people, including with Down syndrome, who've had vaccines are going to be much less likely to have really concerning things happen to them. I think my concern, you're right, Lori, I think it won't be big lineups to get vaccines. So on the one hand, for everyone who stood in the middle of the winter outside to get their first vaccines in ridiculous situations, you don't have to worry about that anymore, but I'm worried that people don't get vaccinated. So I'm just looking actually at, this is only for Ontario. I'm not sure what provinces people have come from. I can put the link into this after. But ICS gives a sort of snapshot or a dashboard about how people are doing with vaccines. And they actually include information now looking at 1, 2, 3, 4, 5, even 5 doses. They have information on people with developmental disabilities in adulthood. And I'll tell you that we did pretty darn well with our first and second vaccine. But when we look at our third vaccine, for people who are sort of above the age of 60, which is a more concerning age, the older we get, the worse things get. If you have a developmental disability, we're seeing 81% of people above 60 had their third, and 57, so it dropped, had their fourth. 34% had their fifth. So not great, but still a lot of people in that older age group are getting vaccinated. But if we look at our adults who are under the age of 60, 48% of them with developmental disabilities. I just want to make sure I've got the right number here. Actually, it's 55% of those with developmental disabilities had their third vaccine. 25% had their fourth, right? So, and that's now. The fourth vaccine was out for a long time. So I do think it would be really an important message here is to think about, come the fall, it's probably good to get vaccinated before we're all panicking because things are really bad again. It is good to keep those vaccines updated. So getting the fourth vaccine and certainly the third vaccine for people who stopped after two will be important if we have another wave in the fall.
Okay, thank you both. Do you think, again, and that's really good information. I'm wondering, do you think there's likely to be a new vaccine in the fall that's more targeted? And I was going to ask if adults with developmental disabilities are a priority, will be a priority group, but it sounds like it's going to be no problem at all to access vaccines.
Yeah, I think in terms of the priority issue, the priority was an issue because we didn't have enough vaccines and we couldn't vaccinate people quickly enough, right? But now that we recognize that's not the problem. The problem is just making sure people see that vaccines would be important. So your question, Amy, is whether maybe we'd have like another kind of like a newer version of the bivalent vaccine, like the trivalent vaccine or the quadrivalent superpower vaccine. Lori, I don't know if you've heard anything about this. I don't know what's new and what's coming up. I know that there's been work looking at sort of intranasal, like vaccines right now are going into our arm, right? And then they're sort of going through our bloodstream and they're helping us get vaccinated, but there's more work showing that it's helpful if it goes right into the place where we tend to catch the virus. And that might also be easier for some. There's a few people who have a really hard time with getting needles. And so a sort of intranasal kind of spray or something like that might be helpful for them. And maybe that's something that's going to come up over the next year or be more available. I see Lori's camera's off, so I'm not sure if she had to slip out for a moment, but she might have more information on some of those things than me.
Okay. Wondering too, there's some people who it's been over 6 months and they would be eager to get another shot, like let's say a sixth shot or a fifth shot or whatever it is. Let's say they've already had their booster, but it's been 6 months. And technically they're saying it's only certain priority groups, so such as you're over 65. So is any advice on that? Is that worth pushing to try and get now, wait to the fall?
So the challenge here is it looks like Lori has disappeared for a few moments. So I don't want to sort of offer someone kindly called me a doctor, but I'm a psychologist. I'm a doctor of studying things, but not if you never want me to give you your medical care. So I don't want to go too far with that one in terms of answering that question. So maybe we'll wait for Lori to come back on that.
I don't mind jumping in on that a little bit, and I am not any kind of doctor at all, but I do have a great relationship with our pharmacist, and I actually had my seventh. I am somebody who is immunocompromised, and so my pharmacist's recommendation with my family physician's blessing was every 3 to 4 months. And they gave the same recommendation to my daughter. Again, I can't give out any medical advice, but a pharmacist is a really easy person to get a hold of because they're available at pharmacies. So I found some great information from pharmacists. So if that's helpful to anybody, maybe worth asking the question.
Yeah, so maybe the hint there is the importance of having conversations and remembering that there's sometimes a few different people that you can speak with. At this point, you can talk with your doctor, you can talk with your pharmacist, and that people's situations are different. We're not all the same, so our decisions are not all going to be the same in terms of what it is that we do. And if there's something you're kind of sitting with that just doesn't feel right, or you feel like, why am I not being allowed to do this? Is this bad? I want to understand it. that's a great conversation to have with a healthcare provider, whether it's your doctor or your pharmacist. So I'm just seeing in the chat box, people are commenting on the importance of having those kinds of conversations.
Okay. Maybe it makes sense for us to go on to mental health and then we'll go back to more of the medical things. Does that make sense? Leanne, would you be willing to jump in and start to do, oh no, we had physical health. Hmm.
We can do a little mental health for a bit and come back to
Some
systems.
mental health.
Yeah.
Oh, and I think that's me. Okay, mental health. And I know there's some good mental health questions in the chat as well. So this would be for Natasha and Yona. Anxiety, good old anxiety. I know my own daughter's experienced a ton about things she used to do. Now taking the bus, waiting for things, like really, really high anxiety, and this seems to have been again developed over the last 3 years. And was wondering, are you seeing a lot of this? Is this level of anxiety the new normal? For a lot of our adults and loved ones, and strategies, recommendations about that.
Yeah, I mean, anxiety is probably the predominant issue now from the pandemic. And you know, it's not just my patients, it's myself as well, right? I think we're all experiencing it to some degree. You know, not wearing the mask is something I feel quite exposed, I will say. It's been a while to transition to that. Actually, not wearing a mask is what I normally would not have done, right? So I think trying to normalize that the pandemic, while it started quite abruptly, it did last for a number of years. And so, kind of coming away from the pandemic and going back to normal is going to take some time. We have to be kind with ourselves, kind with others in terms of, you know, being patient with the time it will take. Um, in terms of whether it's normal, I would say no. I do the work I do because I don't think anxiety is a good thing when it becomes disruptive, right? When it prevents you from doing what you love to do, what you should be doing. We don't want that, and you should certainly be seeking help if that's the case. Um, yeah, I don't know if I answered the question fully. Was there for something else, Amy?
I guess this would we could have Yona jumping in too again. So let's say you're seeing this incredible amount of stress and anxiety, and you may live in a community that don't have a lot of resources. Where would you go to get some help?
Yes. It's so interesting because whenever I give talks, I will admit my personal bias is I always think of Toronto, and I'll always suggest people come to CAMH where I work. And then people often remind me that there is, you know, other people in attendance. I think I'm gonna have to lean on Yona in terms of alternative options. So I don't have any formal thoughts, but I think going to your family doctor is definitely one resource if you have a family doctor. Going to the emergency department whenever there's a crisis, whenever there's an emergency, is another option. Um, in terms of other resources, maybe Yona can help me out with that.
Yeah, so I'm going to paste in one example of a set of resources I keep going back to, which are these sort of self-help booklets that have a lot of information around dealing with different kinds of intense emotions related to COVID. And we're actually doing some work with these booklets. They were developed at the University of Glasgow. They're in French and English, which is very cool for Canadians here. But I thought, well, they're very COVID specific, you know, what do we do for non-COVID stuff? And I actually went back and I read every single booklet again. And I was like, there's hardly anything about COVID in here. So if the word coronavirus bugs you, then don't look at these booklets. But if you can get beyond that, there's a lot of good strategies and ideas. So it's just one example of a resource. I will say that, you know, sometimes we say with anxiety or with any intense emotion, name it to tame it. And it's this idea that if we sort of just acknowledge that this is part of what's going on, that could be really helpful. And I think sometimes for people with developmental disabilities, they don't know that it's called anxiety, right? Or they don't know that actually other people are also experiencing anxiety, because what they see is everybody seems like everything's normal, right? So sometimes just being able to have that conversation and acknowledge it is a really useful step. For some people, kind of talking about it, you know, is actually even more anxiety provoking. So, and for all of us, sometimes distraction is really helpful. So there's things that we can do that are just kind of not focusing on the thing that makes us anxious. But sometimes the things we do to distract us don't actually make things get any better. And so kind of being able to sit with or be with anxiety is a helpful strategy for other people. So again, I think it depends on who you are. But I think, checking in with your healthcare provider, even if they don't specialize with this population, just kind of being able to describe, like, these are the kinds of things that are going on, the kinds of things that we're seeing. Is this, do you have any ideas? Sometimes someone who knows you really well, that's a really important kind of expertise, just like someone who knows anxiety really well. That's a kind of expertise, So seeing a healthcare provider who knows you well or someone who's worked with you before, I think can be a helpful step. And knowing that not every strategy works for every person, right? That we have to kind of look at different things. Sometimes there's trial and error. But kind of knowing for yourself what's kind of typical for your family member with a disability, and how is this kind of different? And who's it a problem for? Like, this anxiety is a problem for them. Are they really distressed about it? Or is it a problem for you because you feel like things are supposed to be a different way? Sometimes I know I found this even in my own thinking with my sister, just thinking about, well, maybe there's a little bit of wiggle room here around what I need to do, or what kind of the situation should be around my sister to help her with her anxiety, as opposed to just expecting kind of her anxiety to change right now. Because it's pretty expected, almost, given all the stuff that's going on, that some things would be really hard. And maybe my last point about anxiety is that, we're not just anxious about things that are bad. We're anxious sometimes about things that are different. So sometimes we forget with anxiety, we think, well, why would you be anxious now? Everything's opening again. There's all these things you can do. What's the problem with that? It's still change, right? And it's still something that you're not used to. And in fact, as restricted as everything was before, it was something we got used to. So all kinds of change, I think, can be difficult for people. So we need to think about kind of gradual ways to kind of move with that over time. So maybe having expectations that allow things just to kind of move toward getting a little bit better, as opposed to being amazing, and ways we can kind of accommodate or support people in the situations they're in at this moment. And I saw Joanna put in a really nice resource that's useful around anxiety for autistic people, our mental health literacy guide that was developed with autistic people and with families, as well as the family dual diagnosis guide, and then a new piece that's just come out around autism and depression for young people. So a couple different resources that give us some hints about things to do, even before we can kind of see that specialist, and to push with the people you're already seeing who provide healthcare to you, to see how you can get that kind of help, even if you can't get it right away. Welcome back, Lori. We switched to talk a little bit about mental health. We're guessing you're having some anxiety because your internet, it looks like, wasn't working for a little bit, but we're glad you're able to join us again.
Hi
We
again,
get?
Lori. We are going to switch. We are so flexible. Like, what an amazing group, all of us and all of you. We were starting with all those COVID questions, and we're back. We're very glad you're back. And we had a question about what happens if you're getting different recommendations, like, I guess different recommendations about vaccine and coping with COVID from your, let's say, your pharmacist and your family physician. How do you balance that out? Who do you listen to? We had a little talk before about pharmacists as well.
Yeah, no, and I think that's always a challenge too. I think right now, like, just to go back to Yona's comments about vaccination, I think that's the thing that came out clear, is that that's what's reducing risk. That's what's reducing severity of disease. That's what's reducing spread to the levels that this doesn't look like the first one, beyond the fact that this, this virus, this version of the virus is slightly less, makes you slightly less sick, and keeps you out of hospital mostly. But I think one of the ways to deal with that is to sort of look for resources in your area from public health too, because Toronto Public Health posts some of these on their guidelines. They will want to make sure you have 3 doses before you get the latest vaccine. And that's probably the way to go if you're worried about how many to get. So that group that's had 2, it would be recommended to get number 3, unless you have any contraindications or really bad effects from it. And then you could skip the other ones and jump right to the most recent one. And the most recent one, there'll probably be a new one in the fall. And that could be the one to go to, because they'd be bivalent vaccines. They'd cover sort of more than one strain. And so I think that part's it's definitely an important part of this. Yeah, and I think if you don't feel comfortable with those kind of things, you're looking at things to mitigate risk, like masks and those kind of things. And everybody, I totally recognize everybody's different. And so we're really tailoring to the individual sort of patient and deciding what looks like the best strategy for you and your family. For sure, the vaccination piece has been a key piece about keeping the numbers and hospitalization rates down. And I think that part's pretty important. If you've had COVID, then it makes sense that you probably don't need a shot for up to 6 months. Once you have COVID, you've got really great protection for a while, but it will go away. It doesn't protect you forever. And so when that tails off, it's really good to come in and make sure that you get the most recent booster from that one, like the most recent shot. And if you're skipping ones in between, it's okay as long as you've had the initial 3.
Okay, thank you. You were mentioning masks. We had another question about that too. Someone said that their daughter is fully vaccinated and bivalent and is still really wants to wear a mask all the time, like on the bus, out with people, out in stores, in public settings. And a parent wondering is, should she be encouraging this? Is this just because of anxiety? Does it matter? And any advice on that?
Yeah, no, for sure. I mean, I know as a provider too, you get sick a lot less when you're actually wearing the mask, when you're seeing, tons of people that have illnesses. And it's hard to make that choice about doing that. I think as fewer and fewer people are doing it, sometimes you can wean off some of those things. I think it's some of the strategies, that you're usually using for sort of behavior changes that will work for those. I think if you are for sure, sort of Dr. Muller's advice around the masks is, yeah, it's definitely going to lower the risk of acquiring it. Mostly they're dealing with it as being a personal decision. In hospitals still we're required to wear them, but no longer in places where there's not patients. So you can see sort of institutions moving in the direction of using it less and less. I think at big events, we're still seeing smaller sort of outbreaks off and on. And so it may be something you're trying to selectively put in, but I know that's difficult for some people. It's either on or off. This is a routine or not. And so I think you're adjusting to what's around you too. How much risk is there where you are? It's certainly not the same everywhere, especially in places that don't have as many people around. And that may be something to work towards, as to weaning off if you're in circumstance.
I'll just add, obviously I agree with what Laurie was saying. I think I would also want to know why they're wearing the mask. Because, of course, there's part of it might be worries about getting COVID, but then I find some people are wearing the mask for other reasons now. They've gotten used to it. It's hard to change back. It's become their new normal. But also, what I find concerning is sometimes it's a way to hide, right? Like we can use our mask to so people don't see us literally, and that we don't want that, right? So I think trying to figure out why they're using the mask, what their concerns are, and addressing that might be a good starting point.
Last thing I'll add again is that again everybody's different, and who's distressed about the mask wearing? Are they distressed about it? How much is it interfering with their day-to-day, or are you just distressed about it, or someone else is? Because sometimes if we have to pick, there's so many things we don't have control over, right? And so we have to think about, is that something you have control over, whether you wear your mask or not? And is that really that harmful? And do we need to take that bit of control away? Because it's really nice to be able to have choices. And there's so many things that have happened where people haven't had choices. So I think really understanding what's kind of behind it and figuring out what works for somebody, and knowing that, just because this made sense last week, maybe it's different this week, maybe it's different next month. And for us all to try to be a little more flexible and kind of seeing that things can change in terms of that kind of thing, both with other people wearing masks and with ourselves.
Okay, thank you. I just have one final question from a COVID perspective, and then I'm going to throw it over to you, Leanne. Any insights on long COVID with this group of, and the impact of long COVID?
No, it's a great question. And I know in certain kinds of disabilities, it's thought to maybe be more common. So that research is very early on in looking at that. I do know that from an infectious disease standpoint, what they're saying is it's much less common if you're vaccinated, right? And so they fall back on the point of prevention for that kind of developing. I'm not aware of research that says that the developmental disability group has a higher risk of long COVID. And certainly I have not seen that in my experience, but I don't know whether Natasha or Yona have any comments.
Maybe one thing I'll say, I think the challenge here is that, you know, how we define long COVID, we're still kind of figuring that out, right? And a lot of it's based on kind of our own observations of what we've noticed about ourselves. And the people who kind of came forward at first saying, I've got long COVID, were people who were really good at noticing stuff about themselves, right? And very strong advocates who could speak to those things. And sometimes that's more difficult for people with developmental disabilities. And sometimes we do this thing called diagnostic overshadowing, where somebody has this problem, and in somebody who doesn't have a developmental disability, we say, oh, that's long COVID, right? But with someone with a developmental disability, well, that's just them, right? That's their disability. So we might miss what's happening if they're not as good at telling us about the symptom. And if we're kind of missing the fact that this is a little bit different than the usual stuff that they do. So I think it's really good for us as families and as healthcare providers to be thinking about, you know, it's not great to get COVID, and it's not great to get it multiple times. And some people may take longer to sort of feel like themselves again after. And we maybe have to look a little more closely or be able to describe to others what that difference is, why we think they're a little bit different now. We should question whether it could still be long COVID. We want to make sure that people with developmental disabilities aren't denied treatments for long COVID just because they're not as good as describing what's going on. And remember that, again, if someone's not doing something because they're not feeling great, that's different than not doing something because they don't feel like doing it. So if maybe they're just not really feeling quite like themselves, or their memory isn't working quite as well, and they've got this kind of brain fog, or they're really tired, or they're in pain, you know, to recognize that would mean that we'd actually have different expectations of what we want them to do. So I think we don't want to miss long COVID in this population. Yeah, but we're still figuring it out. Participate in research. That's how we learn about things, right? If you're noticing stuff, make sure people know about what you're noticing and what you're learning, and let's keep sharing information with each other.
Okay, Leanne, I'm going to pass it over to you to ask some more questions about physical health.
Thank you. And yes, participate in research. We'll keep repeating participate in research because it's a great way to support all of us and to support our loved ones and the population. So I'm echoing Yona's words. So I've been given the task of asking questions about physical health. And being the parent of an adult who has struggled with physical health, mental health, autism, I have a very hard time even categorizing and siloing the issues, because I think that they're relevant in every aspect. The physical health impacts the mental health impacts the developmental disability and the expression of it. So I'm just going to throw these questions out and hope that anybody on the panel who wants to answer can just jump in from their perspective, because I really have a hard time separating them, even though my notes here are separated into categories. So one of the questions that has come up quite a bit in my home, but I know from many people who have sent in questions, is about the sedentary consequences of COVID, and having been locked down for such a long time, missing out on opportunities for exercise, turning to eating as a way to cope with some of the stress and the anxiety. And there have been a lot of people who have struggled with weight gain and the impact of weight gain, overeating during COVID over the past few years. So just a discussion about weight gain, eating, healthy living, being able to move again. In our situation, my daughter's physical health deteriorated to such an extent that exercise was no longer an option. And that will ultimately lead to the next question, but I'll just stop there and see if anyone on the panel wants to talk about that a little bit. Oh, everyone's being polite. So Lori, go ahead.
So I was just going to say, I find that's a very individual issue to deal with based on the whole families. They are, what's accessible, what the interests are. A big part is what interests are, I think, too. What's going to work for that in terms of plans that people can stick with. I think it's very challenging. I don't know, Natasha or Yona, if you have more behavioral kinds of suggestions with that.
Oh, Yona, you're on mute.
Thanks. Your point, Laurie, about what people can stick with, right? So again, kind of what's okay, what's kind of normal or what makes sense is really different for every person, for every family. But it is a big pressure when we have like a goal we set that's just too hard a goal to get to, right? Because every time we fail at things, we kind of feel really crappy after, right? So what's kind of an attainable goal and what's something that everybody kind of agrees on? It's hard. You can't just say, well, you used to do X, Y, and Z, so just get back out there and do it. Because you know what, your body doesn't remember how to do that, right? And the way you eat if things have changed, we have to kind of gradually try to work towards something. And it can be better maybe to set a small goal people kind of agree on. And also finding ways to make, both sort of how we're eating and what we're eating and also what we're doing fit with things that are meaningful, right? So like, is there an activity that allows for more movement? That fits, that is a choice that someone actually wants to do, as opposed to like you have to do it this way even though you don't like it, right? So finding things that people are more into, I think, can be helpful that way. And then again, same thing with food. Is there, what stuff is there? What are the choices? How do we start to change how we eat? Is a big thing, and it's an issue I think for a lot of people, not just people with disabilities, right? So, and where people are at in terms of how ready they are to change and take those steps is a really important thing to consider. Again, my comment before about how so many things have been taken away in terms of choice and control, that we have to keep in mind, like, how can people feel like they have control over this, right? And how can people feel like they're making choices as opposed to things being put on them? And is this the right time for this kind of intervention or change? So small pieces and also choice, I think, are two good things to keep in mind.
I'll just add that certainly at CAMH and elsewhere, people are starting to use medications for weight management. So things like metformin and now Ozempic. I hesitantly share this because I would like people to be cautious around the use of these medications. We don't know what the long-term risks are, but acknowledging everyone has different body sizes, it's different weight loss for different people, and so sometimes there is that need, and so having that conversation with your doctor might be helpful.
Natasha, you answered my next question before I even got a chance to ask it. I was going to say that, so many of our loved ones are struggling with weight gain. Many of them have been struggling with weight gain as a result of medications that they're on, struggling with metabolic syndrome, struggling with prediabetes. So I'm so glad that you did bring up that there is a metabolic clinic at CAMH. And I'm pretty sure there's research that's going on as well. So throwing that out there for other families, I think is a really is wonderful. So I'm glad that you did bring that up as a possible.
I'll just add, Leanne, just to your point around the research, there is a really great research specifically on adults with developmental disabilities being seen at that clinic. And so the data is quite promising in terms of the weight loss. And I will say what I like about the clinic, it's very holistic, right? So it's not just the medication, but they also have advice around diet, and they do encourage exercise and taking a more holistic approach, which is nice.
Yes. Thank you. Thank you for sharing that. Are you able to answer the next question before I ask it also?
My superpowers aren't that strong.
Okay. So the next question is really around going back to regular doctor's appointments. And I think so many of our loved ones, having had virtual appointments for so long, they might be behind on regular blood work, imaging, regular tests, and now with heightened anxiety, how to support our loved ones getting back into being able to have those regular tests done. Any tools that might be helpful, any suggestions, anything that you've seen in your practices, and that you might be able to offer to our participants here.
Maybe I'll start. I think that it's really important to get, because I see Lori's camera is off again. I'm not sure if she's having that same Wi-Fi problem. But you know, I think going back and checking in on healthcare, both for you as a family caregiver and also for your family member with a disability, is really, really important. And you know, it does get hard. You know, blood work, for example, if that's something you're kind of afraid of or really uncomfortable with, the longer you go without doing it, kind of the more scary it can be. So there's different strategies, different resources. I can paste a couple of them into the chat box that might help with that piece, but it is really important to get back to some of that health screening that maybe was missed, and to do blood work to see which kinds of things are going on, and to find ways to make it feel a bit less scary if that's kind of a barrier for people. Yeah, I don't know if that helps to answer your question. Again, it'd be nice to hear from Lori if we're able to get her back online, but I'll share a few resources specifically around the blood work piece that might be helpful.
Yona, are there social stories specific to that?
Yeah, there are. So the three things that I grabbed, let me just find them here. There's a nice toolkit that was developed by Surrey Place. I'm going to include the social story around getting blood work done. So here's the social story. And then I'm going to include a video, a very popular video that I'm quite proud of actually, of Francie, who was really afraid to get blood work done in the lab, and sort of how she got a little braver and did her blood work. And then the third one is just for people who can go to Life Labs in Ontario, BC, and I think one other province, because Life Labs has a specific program around blood work for autistic people. But I think if you didn't have autism and you called anyways, you could still use the same thing. So sometimes you can arrange to have blood work done at home. Sometimes you can arrange to make the environment a bit less stressful. You can stage things out. So all we're doing is visiting today, just like the dentist. What is worse than going to the dentist? And think about how many people have been able to figure out dentist stuff over the years. Why? Because we gradually get ready to do stuff, right? And we do it repeatedly over time. And so it gets easier. And so I think it's the same kind of thing with blood work. Some people will say that actually vaccines got easier over time because they had to do it a bunch of times close together. So it actually got easier than the very first time, which was kind of scary. So Life Labs is Ontario, BC, and one other province if you go to that link. And they have some specific accommodation things they can do. And again, it's something good to talk to a doctor about. If your doctor feels like they don't know too much about these things, there may be someone in a developmental disability agency where you live who may have some ideas about that. You could ask if you're in Ontario at your local DSO office. In other provinces, I could, again, if you reach out to us, we could help give you some resources. But there are some people who have expertise in this. It's a great campaign for kids, and it's around needles in general. And a lot of those resources, again, that have worked for kids can also work for adults with developmental disabilities. Lots of work, I think, and lots of ideas. We just have to get creative sometimes, and we have to be patient. I think it's really helpful sometimes to think about, again, choice and control. How do we help someone feel like they have a little bit of control? How do we gradually help people get used to something? And people who are very scared of things can learn to do things if we come up with good gradual approaches.
Thanks, Yona. I think I lost everybody for a second. I think it was me. I'm not sure. Is Lori still here? No. Okay. So we might need to wait for Lori. So I think that there is a great question in the chat asking, how do you teach a teen to swallow pills? He can't, and anxiety sets in. So Natasha, I don't know if that's something that you can speak to, or if we want to wait for Lori to come back online.
You know, I can speak to it. I mean, there's different approaches. Some of the medications come as a liquid form, so that's worth looking into at no additional cost. You can ask your pharmacist. Otherwise, what I'll do sometimes is I'll prescribe smaller doses of the medication, right? So you take multiple but smaller tabs. And then also some medications, there's the option to open the tab. You'd have to ask your pharmacist if that's possible. You could put it in your food. You don't have to necessarily swallow the whole tab. So there are various options, so worth exploring.
Thank you, Natasha. And I think actually, Natasha, you and Yona, I'm sure, could be able to answer this question as well. What is the best approach with our current physician if they're not receptive to preventative health care for adults with IDD? And so I guess this idea of, going to the doctor when there's an emergency, yes, but the idea of preventative health care for this population is so critical. And I guess some people are struggling with their own family physician. So any recommendations around that?
I can start, and then Natasha, maybe you can jump in with some of your experiences. I think the struggles that we have, like let's not pick on the family physician. It could be with any one of our doctors or healthcare providers that we're seeing, right? And one thing I like to think about is sometimes we think a struggle is going on because maybe somebody doesn't care, somebody doesn't understand, but there also may be a bit of a communication gap, right? Like they may not realize what it is that we're really asking for. And so sometimes it's helpful to kind of step back and say, well, do we all have a shared understanding here of what kind of the issue is? And sometimes people don't want to do things because they don't actually know how, right? And so sometimes we might have resources that can help them figure out the how, or we have to have another conversation where we kind of are on the same page around what's realistic to expect from anybody to do. And sometimes through that kind of positive interaction and learning, then things can get better, right? But sometimes I think maybe there can be situations where, after kind of repeated trying to sort of like have a better understanding from each other, have that kind of communication, sharing those resources, still it seems like it's really not being understood, or it's just not the right match. Sometimes I think we have to maybe explore, is this working? Does this make sense? But I don't know what Natasha and Lori think about that. We're just talking about kind of what happens when it feels like the doctor's just not getting it. What you do in that kind of situation when it's kind of really being harmful to your family member.
Leanne, are there examples of what they mean by preventative healthcare? I was just curious.
There aren't examples here, but I mean, I certainly could. I think that I could speak to some, and I imagine Amy could probably speak to many as well. But we're very fortunate that we have an incredibly proactive physician. So there are regular blood tests that are done preventatively. There is a full checkup that is done probably a little bit more frequently, monitoring heart rate, blood pressure, monitoring medications, and also just a check-in, both the mental health, physical health check-in, just how are you doing? Bowels, we don't talk about poop enough, but poop is a really important thing, and just sort of women's issues. So just when there's not something specific, not a strep throat, but just making an appointment to just be able to manage preventative care. And I love saying poop in front of people.
We like poop in our house too. I just wanted to add, I think the person who was asking that question was asking about physical issues that are common to adults with Down syndrome. I think that was the context.
Gotcha. I will add that there might be a knowledge deficit then. Not everyone is comfortable or aware in primary care and beyond, even psychiatry, with specific medical issues. And so I agree with Yona, it's around really trying to understand where they're coming from and maybe trying to advocate and I know it's not your role, but maybe trying to teach that this is an issue. And yeah, and going from there. But I don't know if we lost Lori because I think she probably could speak better to this. Oh, okay.
Lori should be back. Lori, you with us?
I know that there are now more common like developmental pediatricians who are feeling more comfortable kind of filling in that primary care like family doctor role, but with the added lens of someone with a disability who might need more developmentally appropriate supports. So maybe trying to, I mean, of course, they're not very common, but trying to look for something that fits more your needs. Wow.
Yeah, I mean, I think the challenge, of course, is that the developmental pediatrician's really usually going to work with children and not so available for adulthood. But I think, again, sometimes people can learn when they have the right resources. And It's not really important always that everybody knows everything about the topic. It's equally as important to know everything about your family member. So sometimes people can work together and get advice. In some regions, you can sometimes do things like e-consultations where you can actually get advice or support from someone else who specializes more in a certain area, even if you can't see. It's almost like doctor to doctor kinds of discussions and other things as well. But yeah, I think it's, these relationships are really important, and maybe kind of looking at how to navigate them, and when it makes sense, that it's working or that it's not. I guess it's a very personal decision, isn't it? And it sort of depends on what else is going on, and where people are at.
So I think we're still waiting for Lori to come back, but since we did have categories,
I was going to say, Leanne, just to not to interrupt, but Lori put in a really important comment here because she's having those tech problems, and it was tip of the tongue and I didn't say it. But in terms of helping those primary care providers who don't know a whole lot about this population, there are amazing tools that exist, and we can paste the link to the Surrey Place primary care guidelines and tools, a lot of point of care tools that healthcare providers can use with their patients with developmental disabilities, including a series of sort of health watch tables in answer to your question, Amy, about Down syndrome. It actually outlines the specific things we should be doing for people with Down syndrome and sort of explaining to the doctor kind of how to do that piece. So those are really important resources. And here in Ontario, as Lori says, there's actually a new billing code which allows the physician to take that extra time to do what we call an annual health check. So a lot of you might be told by your doctors, oh, we don't do checkups anymore. We sort of figured out those things don't really make sense. We don't do annual checkups. But for people with developmental disabilities, we should, because they're not always as good at identifying what kind of health issues are going on as quickly as we would like them to. And so doing that sort of thorough discussion, just checking in on everything, is really important. So there's now a new billing code, and even your healthcare provider might not know about it. And this is just for Ontario, but there is a way for that doctor to spend some extra time with you to really look at that sort of whole person check about what's going on. And there's resources on the primary care website that help you to do that exam.
That's actually great. I didn't know that, and I would question, given the big umbrella of developmental disabilities, I would frankly feel comfortable telling my doctor about what was it, the billing code? If I didn't have enough time, I would invoke K133 if I had to.
I'll see if I can find the link and we can share that as well. But again, it's specific to Ontario. There's some really nice resources actually also published by the College of Physicians and Surgeons of Ontario around working with this population, and also some really nice resources through the College of Family Physicians. So I'm going to see if I can find those as well.
Thank you. And in the meantime, Amy, I will pass it along to you so we could go back to some of the mental health questions that we started, but I don't think we got through that, did we?
Yeah, let's do that, even though they overlap. I just wanted to add one thing. It gets a little tricky if you go to your nurse practitioner or family physician and say, so have you seen all these resources? Because it could be, yes, of course I have. So it's kind of a little bit of a dance. The other thing I wanted to say, there's some great resources. That there's a forum called, for example, the COVID check-in, which is for a checkup after COVID or at this point. And I know there's different versions. There's some that have pictures, and my daughter filled that out with my help and brought it into a nurse practitioner, and it was really wonderful, and it helped her to really address the different areas that she wants to talk about. So there's some fantastic resources. I want to mention that as well. So going back to some mental health issues and some of the questions, some of you were asking about the idea of loss, and pretty well everyone says that the life that our loved one might have had is completely different now, or it is gone, or it is lost, and just any ways of supporting our loved one with just all those losses and the loss of the previous life they had before. Yona, do you want to go first?
Yeah, sure. I'll dive in, and Natasha, you can jump in too. I mean, I think loss is like one of those words that really can resonate with all of us. Sometimes, again, just like I was saying, people don't want to talk about COVID anymore. People don't want to talk about loss. They just want to like keep going, right? I don't want to see that. But like that's part of us, right? That's part of what's happened. And there's loss for people with developmental disabilities, and there's also loss for us. And sometimes I like to remember that I've also had loss because it helps me to relate and think about what's going on for my sister in a different way, right? Like we've all encountered loss and we all deal with loss differently, right? I know for some people with developmental disabilities, that kind of sense of time is a little different than it might be for a neurotypical person where like something happened maybe quite some time ago, but it feels just as fresh as though it just happened, right? So we have to remember with this experience of loss that we all understand loss differently and we all literally experience it in different ways. So your family member might not experience it in the same way as you, but you might be able to relate to it because you've had losses yourself. And there are things we can do to kind of mark loss, to recognize loss, and then to kind of move forward, right? But sort of embracing that that loss is still a part of us that's happened. And I think when we sort of give room for that, I think that can be helpful for some people. And again, that sort of name it to tame it. I use that expression for anxiety. I think it's an expression for loss too. So letting people actually talk about loss and allowing people, like, we don't have to make everybody happy all the time because that's not a big problem anymore. It actually is a problem. There's somebody kind of trying to communicate, hey, this is something that is part of me. Okay. So validating that, I think, is an important piece. And then trying to think about what was important really about that, and also what else is kind of important here, and how can we kind of move. So I think those are things that might be helpful, but definitely loss is a really big issue. And it's not just like loss about death. You know, we grieve things that change, and it's not just people that die. There's lots of things that change, and that experience of loss might feel the same to someone, even if it's not a death. And I think we have to recognize that something that someone else might think is small can be really big for somebody with a developmental disability.
Natasha?
Leanne wanted to say something.
Thanks, Natasha. And actually, I think you'll probably be able to answer this. So I'm glad that I'm getting a chance to throw this in first. One of the titles that we threw out for this webinar was the lost years. And one of the reasons why we talked about that was, you know, we're all caregivers of kids, of adults of all different ages, but in our home, you know, it sort of went from 19 to 23, and those are a lot of growth years. And for many, those might have been dating years. They might have been academic years. They might have been social program years. They might have been the end of school, but starting something else. And those years feel like they're lost. And there is a grief there. And, you know, being in our situation 23, but still emotionally and experientially being 19 because of being locked inside for so many years. So how does one manage that grief? How do you reclaim those years? How do you become 20 when you're not 20 anymore, or 30 when you're not 30 anymore? So I'm sorry that I raised my hand, but it was just sort of something that really was thinking about as I was listening to Yona.
Yeah, such a great question. I love doing these talks, by the way, because I also get to sit and listen to Yona, and it's really just, I really enjoy everything she says. It's so insightful and wise. How can I top what she already pointed out? I will say maybe it's not about reclaiming, right? And I think sometimes that's where we get frustrated and the struggle starts, is when we're trying to have something we cannot, right? And maybe it starts with acknowledging that we can't go back to our 20s. We can't go back to that time with that COVID took away from us. Coming to terms with that, and then trying to figure out what can we do in the here and now, and what can we do moving forward to start rebuilding our lives, because they're, you know, those are lost years, but there's still many more ahead of us that we want to do something productive with, and trying to come to terms and move on with it.
Yeah, the metaphor of, I don't know who grew up watching the Marvel Universe. I say this sometimes to people and they have no idea what I'm talking about. So I need a couple of emojis telling me they know what I'm talking about. But like half of society kind of like disappears for 5 years and then comes back, right? Like that's what's happened, right? And for some people, like you say, Leanne, it's at this very specific time where certain things are supposed to happen and they didn't happen. So I think knowing that, knowing like what was it that was missing. So A, we have to kind of come to terms with that, but also we have to recognize there's a skill that usually people develop and that learning didn't happen. So our expectations, I think, need to change a little bit, right? And then we think, well, how else can we get that kind of opportunity now? Because we can't go back. We're going to work with what we've got now, but there's maybe a skill or something that's just kind of missing. How do we start to get that gradually? What might that look like? Right? And we're all going to be inventing that together, right? And sometimes I think, that's again an experience where, even if you don't have a neurodevelopmental disability, there were lost years and things that happen. So it's actually something we can kind of relate to again, or other siblings in the family can relate to, or we're all kind of learning about. And it's something we're going to sort of figure out, I think, as we go. But yeah, I think definitely recognize the impact that has and sort of creative ways to gradually kind of figure out what's that little skill we want to pick up that's really missing, and recognizing that they don't have the same skill set because they really did miss that experience.
We had another question, and the person wrote, considering it can be difficult to identify mental health challenges in adults, would you recommend that someone have an annual or semi-annual mental health checkup, similar to checkups you might have with the dentist or with the doctor? Would that be recommended? And if so, who would you go to?
Hmm. So I don't know if I'm misunderstanding the question. So I would agree with the premise if it's around like mental illness will present differently in someone with a developmental disability. We know maybe instead of being depressed or complaining about low mood, they might complain about being more irritable, or you might see more behaviors that are perceived to be challenging, like aggression, acting out. But I do think that like the hallmark of a mental illness, which actually might be a little different than physical illness, is that there should be some change, that we should see either change in behaviors or change in functioning. And if the person is kind of doing everything they normally do, they're not complaining about any issues, then I don't necessarily know if there's a need for a mental health checkup. And the reason I say this is I do worry about sometimes people creating or finding problems where there is none. I think I just say this because I know within the medical community there is a desire to do something, and if like there is that risk that maybe people start a medication or introduce something different when there isn't a need for that. So I do think that there should be a specific concern or a change. We don't have to label it, but if there is, a change in functioning, that would be helpful.
Yeah, maybe I'll just add to that, right? Like if it's not broke, don't fix it, I think is what you're saying, Natasha, which makes a lot of sense. But at the same time, it is good to check in to say, is it broke, right? Or is it different? Has it changed, right? And how has it changed? And if you're not sure if it's a problem or not, you can say, well, I don't know if it's a problem, so maybe we'll just ignore it. No, if you don't know if it's a problem, have someone help you figure that out, right? It's okay to ask a question. I'm going to paste a resource in here. It's kind of a funny one, and I could talk for about an hour and a half on this for anyone who's taken our course. But we came up with this brilliant thing, about a year ago called My COVID Check-In, where we thought this is just a kind of resource or way to kind of check in on all different kinds of aspects of your health and your healthcare. That as a person with a developmental disability, you could kind of look at this, think about which topics you want to bring to your doctor or another healthcare provider to say, this is something that I'm struggling with or I'm thinking about, right? But the problem with the tool, we learned because we actually studied and evaluated it, is a lot of people don't want to talk about COVID. And we put the word COVID in there. And then people are like, well, I'm not looking at that. I don't have COVID. The doctor said, don't come in here if you have COVID. So it's actually really just My Health Check-In tool. That's what it should say. And hopefully we'll change the name soon. But it's just kind of a nice example of what are the different areas in your life that maybe have been impacted the last couple of years. And is there one you would like to talk to someone about? And it could be a psychiatrist like Natasha, it could be a family doctor like Lori, or a psychologist like me, an occupational therapist. But it's just a kind of way of looking and saying, is there something different? Is there something that might be a problem? And then really, if you think there is maybe a problem, it is worth checking it out with somebody.
And the COVID check-in, that tool was one that my daughter used. It was really, really brilliant to bring in. So just a little vouching for that. Leanne, we probably have time for maybe one more question. Do you want to pick one from the kind of the last social category?
Um, Sure, and I think that it's, something that anybody could jump in and specifically talk about on the panel. I think there's a combination of two questions that we could put into one. So, that so many groups have resumed, but many of the groups don't really acknowledge or recognize some of the COVID concerns. Some groups have stayed virtual, while others have just not returned at all. So for someone who is anxious or medically more vulnerable, how to attend groups that don't necessarily have safety practices in place. And I guess along with that might go talking about some of the skills that we might have lost in terms of practicing relationships with actual humans in person. And, that's one is, a real one, certainly in our house. Everything has pretty much remained virtual because nothing that my daughter did in the past ever came back. So I guess Natasha, Yona, whichever one feels like you want to address, let's just run with it.
I'll let Yona start.
All right. So first of all, I think there's different kinds of skills. So it's like, well, how do we get back to our real person skills? And what about those virtual skills? And keeping in mind that for some people have thrived with virtual skills, right? So it doesn't necessarily have to go. For some people, it makes them more comfortable. It means they can do their interaction from their own home. It means their camera can be on or off. It means if they're not a very comfortable speaker, that they can use a chat box if they like to type some of their ideas and they can actually participate more. So some people, that's still something we want to maybe keep in place for some people. Other people really do want to develop some of those more in-person skills. I was actually I was on a big in-person activity last week with a bunch of people, and that one person who maybe would have been really comfortable using that chat box had their phone with them, very simple. But sometimes it felt like it was really hard for them to say what they wanted to say. They'd just show me their phone and they'd sort of typed out the thought or idea. And so different ways for us to practice our communication, I think, and remembering that we all interact in different ways is important. What's your goal in that interaction, right? Like, is it to have an amazing time and to behave perfectly, whatever perfect means? Or is it just to get out there? No matter what, I got out there, right? That's a great goal. Social interactions, I'm really weird socially now, like weirder than I was before, because I don't remember how to do certain things, and a lot of things make me uncomfortable. But just the fact that I try it, maybe that's okay, right? So thinking about what our goals are, thinking about what's a small dose we can try, like what's a little 10-minute dip our toe in the water, as opposed to like a full-on major event. And so thinking about how we pace ourselves that way, and thinking about, again, this idea of choice. Can your family member choose what kind of thing would be really important? And then can we think about how to make that as successful as possible? And maybe redefining success a little bit would be important. But things can get easier over time, I think. So it's good for us to be able to try things.
Yeah, and I think, it's up to the person. So if your loved one does want to reintegrate into these in-person events, I think trying to do it in a slow way, right? In a paced way. I have to say a lot of my patients prefer to come in person to see me nowadays. And I think that, you know, speaks to a desire to do these things, and maybe they feel safer coming to a clinic. I'm not sure. But I think these are good starting points.
Thank you. Amy, handing it over to you to wrap up.
I'm going to wrap it up, Leanne. Okay, so much to think about and so many amazing conversations and ideas. And now I'm going to give everyone here, who was just a little gray box, a little bit of homework for 1 second. We've talked about so many ideas. Is there one thing that has stuck with you, a word, an idea, or something you want to look up? If you could take 1 second and put it in the chat. And it could just be that you need a coffee right now, and that's okay. So just 1 or 2 words of something that really stuck with you from this presentation. Choice, healthcare tools, community. Okay. So there may be some more. At this point too, again, as amazing caregivers, encourage all of you to do something lovely for yourself today. Again, maybe some good food, a walk, whatever fills you up. And thank you so much for spending time with us. Thank you to our fabulous presenters, to all the people that did all the work behind the scenes. And I'm going to pass it over to Teresa, who's going to tell us some more things to look out for.